Hi, my name is Claire Michaels, and today we will be discussing the amazing benefits of breastfeeding. The American Association of Pediatrics recommends that an infant be exclusively breastfed for about 6 months and continue breastfeeding as complementary foods are introduced, with continuation of breastfeeding for 1 year or longer as mutually desired by the mother and baby. So let's start with benefits for the baby. Babies that are breastfed have overall better health and get sick less often. They have fewer ear infections, fewer common colds, and even fewer gastrointestinal infections like necrotizing enterocolitis, which can be deadly for infants. And if your breastfed baby does get sick, she will likely recover quicker than a formula-fed baby. Breastfeeding decreases your baby's risk of sudden infant death syndrome, or SIDS, which is the unexplained death of an infant while sleeping under the age of 1 year. Children who are breastfed for at least 2 months or longer have as much as 50% less likelihood of suffering a SIDS-related death than those who are breastfed for less than 2 months or not at all. Breastfeeding has even been shown to have anesthetic properties for your baby who is receiving vaccinations or other non-surgical medical procedures. Now that we've talked about the baby, let's talk about mom. Mothers who breastfeed their babies in the immediate postpartum period show quicker mother-infant attachment in addition to having significantly less blood loss. Mothers who breastfeed have lower instances of postpartum depression and are usually able to lose weight more easily than mothers who don't, because it can burn up to 500 calories per day. Risk for hormone-related cancers like breast cancer later in life are decreased by almost 40%, and type 2 diabetes is decreased by as much as 35% in women who have breastfed their baby. Arthritis and many other autoimmune conditions also have lower instances in women who have previously breastfed a child. So, what are the financial benefits? The American Pediatric Association estimates that breastfeeding can decrease the healthcare cost by $3.6 billion in the United States by decreasing the need for several public assistance programs. Natural resistance to illness results in less parental workplace absence, and breastfeeding means less demand on the environment, less garbage to throw away, and less energy expenditure. Dads, don't worry that the mom will be having all of the fun feeding the baby. Get baby ready to be nursed by changing his diaper, do bath time, and overall, don't worry, you will bond with your baby. So, what if I can't breastfeed? Well, there are very few true contraindications to breastfeeding, and your healthcare provider can work through them with you to help you avoid them as best as possible. HIV, chemotherapy agents, and use of certain other medications like some antibiotics are not recommended while breastfeeding. So what can you do to help? Always be supportive of new mothers. Make sure to encourage skin-to-skin contact within the first few hours of life with mother, father, and baby. And encourage moms to be educated and to advocate for themselves for the privacy in the immediate birth setting unless medically impossible. Encourage mothers who are having difficulty or who have questions to seek the help of their healthcare provider immediately. Remember, breast milk is the perfect food for the human baby and should be provided exclusively for the first 6 months at least. Breastfeeding provides lifelong health benefits to the mother, aids in maternal-infant attachment, and can also reduce the financial burden felt by new families as they adapt to the cost of their new addition. Thank you for watching, and for more information on breastfeeding, please visit the American Academy of Pediatrics website at www.aap.org and search breastfeeding.